Hello, my name is Samantha Wyman, and I am presenting on sexual disorders and dysfunctions. Sexual dysfunction is defined as a disorder where people are unable to partake in and or have severe difficulty enjoying sexual interaction. This is because they do not have normal responses to sexual functioning. There are four different types of sexual disorders, which include disorders of desire, disorders of excitement, disorders of orgasm, and disorders of pain. Disorders of desire include hypoactive sexual desire disorder and female sexual interest slash arousal disorder. Both of these come from either the male or female not experiencing interest that is necessary to partake in sexual intercourse. The female disorder groups together desire and arousal because without desire, women are unable to be aroused. Disorders of excitement in men include erectile disorder, which is where the man is unable to attain or maintain an erection during sexual intercourse. Because female sexual interest and arousal disorder involve arousal and excitement, there is not a specific disorder of excitement for women because it goes into the arousal stage. Disorders of orgasm involve both females and males and involve early or delayed ejaculation in men and female orgasmic disorder. In early or delayed ejaculation, the man is either going to reach climax prematurely or be unable to reach climax until later, or will not be able to reach climax at all. With female orgasmic disorder, the female is either unable to orgasm, have very mild orgasms, or very delayed orgasms, similar to that of the ejaculation disorder in men. Disorders of sexual pain are more common in females, however, they do also occur in males. These are often called genitopelvic pain or penetration disorder, which will be discussed later on in the case study portion of this presentation. The different types of all of the disorders require different treatments and may stem from different causes. Sexual disorders and dysfunctions are relatively new topics of study and have only just started within the past 40 to 50 years. A lot of sexual dysfunction and disorders cause embarrassment to those suffering from them, which prevent them from seeking out treatment. And because it has prevented them from seeking out treatment, there is not as much information known on it as a lot of other disorders. The history behind sexual disorders and dysfunctions was based in Freudian psychology, where it was believed that people were suffering from sexual disorders because they were stuck in a previous psychosexual stage. Since Freudian psychology has been largely disproved, so has this thought process. And now it is known that there are a lot of anxiety reasons behind it, physiological and medical reasons as to why someone may be suffering from sexual dysfunction or a disorder. Different reasons that sexual dysfunction may occur in men could include medical conditions, performance anxiety, because society has placed a very high emphasis on the intensity and expectation of how a man is supposed to perform, as well as lifestyle stress. This can include alcohol consumption, tobacco use, exercise, or cardiovascular or obesity, other lifestyle reasons such as those. In women, medical conditions, relationship dynamics, and psychological factors may play a role. Obviously, these reasons are interchangeable between males and females, but tend to focus more on the previously mentioned ones for males and females. For both men and women, sexual trauma may cause sexual dysfunction or disorders. Sexual abuse, depression, stress, and difficulty focusing on sexual intercourse may cause sexual dysfunction. The inability for a person to focus on what is currently happening and partaking in stress could lead them to have a performance disorder, inability to maintain an erection, inability to orgasm, and inability to maintain a relationship with their sexual partner. As I mentioned earlier, women tend to have more pain during sex, and this can include vaginismus and dyspareunia. However, dyspareunia may also be present in males. There may also be socio-cultural causes for the development of these disorders, which can include financial stress, relationship stress, death in the family, sick loved ones, and many more factors. Hormonal abnormalities may also cause disorders in both men and women, including high levels of prolactin, low levels of testosterone, and higher low levels of estrogen. Pain medicine, alcohol, chronic illness, and the use of different drugs may also impact low sexual desire. In males, cardiovascular disorders, or just vascular disorders that restrict blood flow to the penis, Obesity, high blood pressure, and diabetes may prevent excitement. Orgasm disorders may include low testosterone, neurological disorders, excess serotonin, multiple sclerosis, menopause, and dryness in the vagina. For disorders of sexual pain, different infections might be at the root of the pain, including urinary tract infections, yeast infections, other sexually transmitted diseases, or menopause, where the vagina is now drying out and is unable to lubricate, which causes dryness and friction, which causes pain. As I mentioned earlier, because the history of research in sexual dysfunction is still relatively new, there's a lot of theories, but there aren't very many solid reasons for sexual dysfunction. Or a common theory for sexual dysfunction and the reduced sex drive is excess serotonin and dopamine. Having too much of these may reduce the desire to have sex, which, with the increase in prescription of antidepressants and the increase in depression, may lead to more people suffering from the ability to become aroused. Different treatments for sexual disorders and dysfunctions include cognitive behavioral therapy, which is beneficial for pain disorders as well as other sexual dysfunctions and disorders. Counseling is also very beneficial for all different types of sexual disorders because it addresses not only the physical reason for these disorders, but it also addresses the psychological impacts, whether that be fear, anxiety, lack of education regarding sex, and teaching how to make changes in a lifestyle to accommodate sexual intercourse. Treatments of infections and diseases are also very important because that might be the physiological cause of these disorders. And there may also be medical interventions, including the prescription of medicine, including Viagra for males, or injections of numbing medications for women who are suffering from painful sex. Counseling also places heavy emphasis on having both members of the relationship present. Having the significant other or spouse present during these counseling and education sessions allows for people to be open and vulnerable, which leads to a new level of trust and intimacy. Hormone therapies and sex therapy are also important for treating sexual dysfunction. Key diagnostic criteria for these different disorders include premature ejaculation, inability to orgasm, pain during sex, anxiety during sex, potential hormone imbalances, inability to maintain or attain an erection, inability to enjoy sex, the inability for the vagina to lubricate itself, and the tightening of the vaginal wall muscles, which prevent penetration. As you will see in the upcoming slides and the presentation of a case study, there are not always one surefire way to diagnose or treat any of these dysfunctions. Now we will move on to my presentation on a specific case study regarding a sexual disorder and dysfunction. In this case presentation, we have a 28-year-old woman who is having severe discomfort during intercourse. This discomfort includes pain and severe anxiety in regards to sexual activity. All of her blood work came back normal for infection, meaning that there is no signs of a urinary tract infection or a yeast infection or any type of infection that could be causing pain. She also had no sign of cysts or wounds, meaning that there was no physical trauma or open wound that would be causing the pain. The typical diagnosis for this would be genitopelvic pain disorder, which is also known as penetration disorder. The likely diagnosis for this would be genitopelvic pain disorder or penetration disorder. This is also known as vaginismus or dyspareunia. However, another disorder or diagnosis could be regarding a disorder of arousal. In the case of a disorder of arousal, the woman may not be getting aroused in regards to sexual activity, so she is not lubricated enough, which causes friction during sexual intercourse and causes severe discomfort and potentially even pain. There are multiple treatments regarding sexual disorder and dysfunction, and specifically for pain disorders. The main treatment would be education regarding sexual intercourse. A lot of times, sex is considered a taboo subject with a lot of stigma regarding it, so people do not know what to expect and go into sex with unrealistic expectations. Some might hear that sex is extremely painful, that it can be extremely bloody, or they hear the stories about women that aren't lubricated enough and penetration is forced, which causes a lot of friction and pain, as previously mentioned. Another very important treatment option is sex therapy. Sex therapy, again, focuses heavily on education, but also focuses on the relationship regarding sex. Both members of the relationship will attend sex therapy, which allows for common concerns, issues, and frustrations to be shared in a healthy setting with a mental health professional. This sex therapy focuses on regrouping and reanalyzing sexual intercourse to allow it to be more enjoyable for both parties. Because sexual strain puts a lot of strain on relationships, having both members of the party present allows for that relationship to be reworked and maintained to lower the chances of separation. Another possibility for a treatment is working to gain voluntary control over vaginal muscles. A lot of times, when there is a intense fear regarding sex, the pelvic floor and vaginal muscles will tense up and not allow for penetration. By focusing on gaining voluntary control over these vaginal muscles, the vagina is able to be relaxed and thus penetration is allowed. Cognitive behavioral therapy has also started to show some signs in being useful for painful sex. Lastly, medical intervention may be needed. However, it still needs to be combined with therapy. Medical intervention might involve injection of pain medicine or topical ointment applied on the vagina to reduce pain. They may also work to make changes in lifestyle, which can include reducing alcohol and smoking intake, making changes in a diet, and changes in exercise. And last, which is a relatively new intervention, involves pelvic floor therapy. This goes back to gaining control over the vaginal muscles, but is also important for being able to properly engage the pelvic floor. There are also many possible complications that can come from treating painful intercourse, but also just from treating any sexual dysfunction or disorder. Because of the expectation on one's ability to perform during sex, there might be a level of embarrassment associated with having a sexual disorder or dysfunction, such as painful sex and not being able to enjoy it like society says a woman should. A possible response to this is defensive behavior in response to the treatment. Because of their embarrassment, they may feel the need to defend any behaviors that they have and defend the painful sex through not admitting that they have a disorder or dysfunction. Another possibility comes from group counseling between both partners of the relationship, which could come from a lack of effort from one side or both sides of the relationship. If one person is unable to put in the effort or unwilling to put in the effort to treating the disorder, there may become a level of resentment from the other side. This lack of effort may also lead to an inability to fully treat the disorder because both parties are not fully invested in the outcome. Because of the potential need for medical intervention, including topical ointments, injections, or medications, there are possible side effects from all of those, which could just be directly from the medication. Allergic reactions, pain at the application site, rashes, etc., can all be possible complications from those interventions. One of the last possible complications that we will touch base on is the sheer time that is needed to treat these disorders. In the case of painful sex, there may be hormonal implications, psychological implications, relational implications, and a level of trust that is not there, which all take time to build and to treat. And by not fully committing or underestimating the amount of time that is needed to treat, there may be a level of disappointment and discouragement from not having the immediate satisfaction of being able to treat it. In a Christian worldview, it's hard to talk about sex. There is a lot of stigma and opinions regarding sex, but especially sex outside of wedlock. If there is a religious person who is suffering from sexual dysfunction while partaking in sex out of wedlock, they might feel a level of shame in the fact that they are doing that, which could stop them from pursuing treatment. There is also the fear of being unable to consummate a marriage. In the Christian worldview, sex is for marriage and is a beautiful part of marriage. That if a person is unable to consummate their marriage because of their sexual dysfunction, they may feel shame in reaching out to a counselor or a member of the church such as a priest or pastor, because they feel shame and that their marriage is not legitimate. However, on this same note of the sanctity of sexual relations in marriage, 1 Corinthians 7 3 through 4 says that the husband should fulfill his marital duty to his wife, and likewise the wife to her husband. The wife does not have authority over her own body, but yields it to her husband. In the same way, the husband does not have authority over his own body, but yields it to his wife. The belief that sex is so important and such a beautiful and sacred part of marriage can lead to somebody feeling the need to reach out to a counselor, a priest, or a pastor because they understand and respect the beauty of sex in marriage. And knowing that their body is not their own, but is to yield to their partner would allow them to understand that it is something that is necessary to seek help through. These contradicting opinions on sex could lead somebody to actively pursue treatment, but can also actively block them from pursuing treatment. So taking away the stigma in Christianity regarding sex can lead to more healthy relationships with sex itself, which leads to more healthy relationships and marriages in the church.